Hello everyone, my name is Kristen Jennings and I am the research nurse with the CKM project team, and this is Vanessa Steinke. She's the project manager with the team. We're here presenting information today that was delivered by Dr. Davison at a provincial telehealth on December the 12th. So we are going to be providing some CKM updates and show some new features of the clinical pathway. So our presentation today, we are going to start with a brief overview of what conservative kidney management is, and then we're going to go over the new features on the website, go over some clinical guidelines that have been updated, and the patient decision aid, and then we will talk about how you can provide feedback to the team. So conservative kidney management is an alternative treatment option to dialysis or transplant. Comprehensive conservative care is planned, holistic, patient-centered care for patients with stage 5 chronic kidney disease. It includes shared decision-making, delay progression of kidney disease and minimize complications, detailed communication including advanced care planning, symptom management, psychological support, social and family support. It addresses cultural and spiritual domains of care, and it does not include dialysis. So this is a pictograph depicting conservative kidney management. In the center there, as we talked about in the previous slide, it describes what CKM care is. On the clinical pathway are the those inner circles, so there's symptom guidelines, kidney disease guidelines, end-of-life symptom algorithms, and the patient decision aid, which we're going to go further into. Of note, we are continuing to work on symptom guidelines for constipation, anxiety and depression, edema, and hydration.
And those should be ready spring 2018.
That's right.
Yeah. So in terms of the new features that we've added to the website, you can get to the website by visiting www.ckmcare.com, and we'll be walking through some of those features here today. First of all, we just wanted to point out that we have updated a number of guidelines, and at the request of a number of our stakeholders, we've also included some new PDF documents so that you can actually download a formatted copy of those guidelines as well. And then Kristen's going to walk you through new crisis action plans that have been created for patients and health professionals, and I'll show you a few other features on our website. All of those features are live now, and so I'll just take you straight into ckmcare.com. So I just wanted to show you on the healthcare professional side, when you click into the clinical assessment, or if you go up onto the top under guidelines, you'll see that each of our clinical guidelines has actually been updated slightly with just new evidence and new information. But if you want to click through and see the interactive patient assessment portion, just choose your patient's GFR level or their functional status, and then you can click on some symptoms. So here, just for the purposes of this example, I'll just choose breathlessness and restless legs, and then I'll also choose acidosis under CKD management guidelines, and then I'll click submit. So you'll come up with your patient's care pathway, and just at the top it summarizes their functional status that you chose earlier, and then you'll see that the symptom management guidelines that I chose pop up here. So we had breathlessness, and at the top right now we have this ability to download a PDF of the breathlessness guidelines that are listed here. So for instance, when I click on the accordions, you'll see what's embedded in each one of the steps. But when I click download PDF, then it just opens up a formatted version of it onto a 2-page document. So that's available for all of the guidelines. I'll just scroll down a little bit. You can see it's the same under restless leg syndrome. Again, the download PDF button is available. And then as I go down again, CKD guidelines under acidosis, once again, the download PDF button is there. And we've updated some of the content as well and formatting on the website. And then under CKM care, this section is applicable to all CKM patients, and you'll see that regardless of the CKM management guidelines that you chose on the previous page. And what we wanted to point out today especially was the new crisis management plan section.
So based on various feedback from stakeholders since the implementation of the pathway was various things that we should tweak for the crisis action plan. So what we've done is broke the crisis action plan into two pieces. So we have the patient crisis action plan and the healthcare professional crisis action plan. So I'll take you to the patient crisis action plan first. And here you'll see we have pictures of it, and then you can download the action plan here. So what we've broken the action plan down to is support, symptoms, and emergencies. So patients and family members want to know who are the members of their support team, who can they call if they're having issues with symptom management, how do they deal with their symptoms, and what do they do in the event of an emergency. So we have tried to make this document as well as the healthcare professional action plan synergistic, so there's information present on both sides. So we have here for patients to fill out with their most responsible healthcare provider to put in members of their interdisciplinary team. And we know that not all patients are going to have a home care case manager, or not all patients are going to be seen by a chronic kidney disease clinic nurse. So we've tried to have it fairly different options for patients to put down members of their support team. And then reminding patients about advanced care planning. So symptom management here, what we've done is after describing a little bit about symptoms, we have this chart for symptom management. So the intention is for patients and the most responsible healthcare provider to walk through this action plan for patients to plan for symptoms that they might have based on prescriptions that are already prescribed. So they can put in their regular dose and their breakthrough dose of their medications. And then the last piece is emergency. So we've done a lot of rewording here based on feedback specifically from EMS and targeting programs that they can support patients with. So patients want to know who are they supposed to call in the event of an emergency. So we've kind of broken it down here for patients of who do they call first, what is the progression, if they can't get a hold of someone, who should they call. And then we've also put a little script here, so when emergency professionals are in somebody's home, they know that they should be telling the EMS personnel that they have end-stage kidney disease, that they have chosen conservative kidney management, and that they are receiving palliative care. This document, we have encouraged patients to include it in their green sleeve and have it on hand if EMS needs to be called to the home. And then we also have the healthcare professional crisis action plan. So this was created in conversations with EMS. We worked alongside them to create a document that could be used in the event that EMS is called to the home, or if patients are need to go into an emergency. So it's for healthcare professionals across the continuum. In the event of an emergency, this is the best way that you can support someone who has chosen conservative kidney management and is experiencing symptom concerns. So we've written here a script for patients, so they're also to keep this in their green sleeve. And if they go to 911, if they call 911 or go to an emergency department, then they are to give this sheet to the healthcare professional caring for them. And then here we've written for healthcare providers that they should refer to the online clinical pathway to have the most up-to-date information on symptom guidelines and algorithms. However, we understand that a lot of people still want to have this paper copy, so we've used this. So this is all guidelines that have been pulled from the website, so from our content for symptom guidelines. And here we've broken it down to what is the most effective pharmacological treatment for these symptoms, as well as rationale for why you would use these symptoms, these interventions. And last year, as I said, we tried to have the document synergistic, so patients are also to relay over here their name, their family physician, etc., so that we have some coordinated care. So that is for our crisis action plans here, which you can find on the website, and they're also available through Data Group.
And so the last part I wanted to talk with you about was the other features on the website. So I'll just show you some of the other resources and how you can get to them if you don't go through the interactive assessment. Just click on resources at the top on the navigation bar, and you can see that we've got a number of different resources. Our patient booklet that we found quite useful to give as a handout to patients. It includes everything about symptom management and crisis planning. It's all located there. And then we have this new bookmark that we recently published just as a way of communicating to our patients and families that the website exists, or to other healthcare professionals. So again, it's something you can either order through Data Group or print off yourself. And then if you're interested in ordering any of our materials, that you can obviously print them off the website, but if you wanted to get bundles printed out from Data Group, we have a list of materials available to order. If you just scroll to the bottom, and we've just listed how much they are per pack, and how you can set up an account with Data Group if you don't already have one through Alberta Health Services. But this just makes it a little more accessible for those caring for CKM patients. I also just wanted to show you how you can subscribe to our email list. It was just a request from some of our stakeholders. So basically, if you scroll to the bottom, we have events and newsletters or useful contacts. Either of them you can get to on how to subscribe to us. So I'll just click on events and newsletters here, and at the top right, it just says subscribe to the email list. So you can click on it and then just give us your email address, first and last name. You can unsubscribe at any time. We usually send out information once every 3 to 4 months. Just about the project and anything new going on within CKM care. We've done a few minor updates just as an FYI to some of our materials, so patient brochures and handouts, and the booklet that I showed you. So if you do have copies of those now, you might want to update them. And we plan to continue updating the website and materials about once a year. Okay, well, I just wanted to take you guys into the patient decision aid tool now. So on the website, at the home page, you can click on patient decision aid, click on the big blue button there, and there's a few new features that you'll notice here. It might be, the patient decision aid tool might just be completely new to you as well. It's only being used by the renal insufficiency clinics in Northern Alberta for about the last 6 months. But we've really found it to be quite useful. You can navigate to the patient decision aid anywhere from the website by just clicking on the top left button here. It just follows you in the header. And then we've also added in these new tabs along the top so that you can kind of go back and forth between the introduction, the survey, and then the personalized results for your patients. And then just for ease of use, we've also added in this feature where you can email yourself or your patient or a family member about your results on the patient decision aid tool, or if you didn't finish the survey, you can email yourself, and it's completely anonymous and confidential. So just so you can retrieve your results and kind of start where you left off. And there's also an improved print feature that we have now. Okay, and the other thing I wanted to mention as well is that none of these changes would have happened without our AHS IT department. The clinical services development team, most specifically Jerry Eisen, Stephen Chang, and Wei He, have been working tirelessly to get these changes into the patient decision aid tool, and we're really excited to show you the new format and functionality. And so we just wanted to acknowledge them and say thanks. So if you've never walked through the patient decision aid tool before, I just want to take you through some of it, and feel free to play with it yourselves as well. So the first page just kind of gives you a bit of some information about what the patient's choices are. If you click on treatment options here, it gives you kind of a summary and a comparison between the different types of treatment. So between conservative kidney management and then the peritoneal dialysis or hemodialysis. And we know that because CKM is not necessarily appropriate for everyone, and same thing with dialysis, that's why we have this tool available for people. But we just wanted to give people some information to compare in advance. So there's information about will people need surgery and some of those major questions that they might have. Can I change my mind from one treatment to another, etc. So that's all available on the first page, and then it goes into more customization, really, to try to help people kind of identify what option would be potentially most appropriate for them. We often get questions about how long people are going to live, and we're using the evidence that we have available in order to help guide what that could look like for each patient. So the first question here is, the first 5 questions are really about patient demographics. So I'll just show you how it works. So if you click on, yes, I live in a long-term care home or a nursing home, it'll come up with a button here for more information. If you click on it, then you can share this information with your patient about their probabilities of survival. So just based on research, patients over 75 years old living in a nursing home have a 58% chance of death within the first year of those who start dialysis. 29% will have lost some physical ability, and 13% will have kept the same physical abilities. If you clicked no, then that more information button will just disappear because it's not relevant to your patient. Again, with dementia or cognitive impairment, we know that it also changes a person's chances of survival. So if you click on the more information button, it just kind of gives you a little bit more detail about it. We don't have the specific statistics, but when people suffer from dementia or cognitive impairment, dialysis often makes them more confused. Dialysis is almost never a good choice for people with dementia or significant cognitive impairment. And then again, if you click no, then that would also disappear. But just for the purposes of this example, I'll just click yes here. And then in terms of age, again, you can go through the different options. See, under 70 years old, nothing new comes up. But if you click 70 or older, there'll be, again, more information that comes up here. So we have statistics for patients older than 70 years old, just that their life expectancy, it is a little bit longer, and this is without any other comorbidities, just looking at age alone. They will live up to, you can expect about 34 months of life expectancy, but you can see that much of that time is actually spent in the clinic, and they're also more likely to be spending a bit more time in hospital as well. But it's something to weigh for a person. And then if you continue to scroll down, how would you describe your health this week? There's kind of good functional status, moderate, and then poor. I spend much of my time in bed or lying down. So you can click on, again, more information, and it just talks about that those who are just less functionally dependent will maybe not do as well on dialysis, but those who are functionally independent will probably do better with it. And then for those suffering from chronic conditions with few other health problems, heart disease, or with many other health problems with or without heart disease. And so we just have a comparison chart showing life expectancy. First of all, the one on the top is the option that you choose, and then it just shows you just a comparison about how it would change if they had many other health problems or few or heart disease. Questions 6 through 9 are really value-based questions because we know that in a patient decision aid tool, it's really important to really understand how this matches up with patients' values. So again, you can go through and just ask your patient, how important is it for you to avoid being hospitalized? How important is it for you to avoid having major or minor surgery? There's just a more information button here about what surgery really means. How important is it for you to avoid traveling for dialysis or clinic visits? And then how important is it for you to have control over what you do with your time? So I'll just click submit here, and it'll take us over to the My Results page. And that will only get filled out once you finish questions 1 through 9, and then it just provides a summary of your treatment options. So it really takes the first table we showed you on the introduction about treatment options and breaks it down into more detail based on your patient's choices and how it's applicable for this patient. So under the My Prognosis section, this is really about survival and quality of life, functional status, and symptoms. But we've highlighted in blue wherever it seems like it might be a better fit for the patient based on their responses. So in this case, I've chosen a patient who is over 70 years old, has dementia, has a moderate functional status. So I was kind of already weighing it towards conservative kidney management, but had they filled it out and they were younger and just more functionally capable, probably, well, dialysis would have come up as the better option for them, and their survival statistics would have changed as well. So each of these statements is modified based on how they responded to the question. And then we just show charts based on their potential for survival based on how they responded. And we have a 6-month survival rate here as well that you can see. And then the next section is really about their values and preferences. So just as they answered through question 6 through 9, it will highlight in blue, again, which option might be better for them based on how they've responded. And we've just kind of repeated that chart on life expectancy here. Then there's a section here just on other frequently asked questions that they can kind of scroll through. And then this next section on additional considerations is just available for people to fill out with these expandable text boxes. So I'm just going to type in a bunch of information here for them to fill in. And again, they can return back to this as they need to finish it later. Okay, so that's really that's the patient decisioning tool. You can start over and start fresh. You can email it to yourself or print your summary, or you can go straight into learning about the clinical pathway itself, and that will take patients into the patient interactive assessment section too. So we also just wanted to mention that there's an e-consultation feature that will be available February 2018 through Netcare to have provider-to-provider consultation. Already you can be connecting through e-referral. They're adding this new feature with some more information about CKM care though as well. So thanks so much for joining us today. If you have any questions or additional feedback, please email us at ckmpathway@ahs.ca. There's also a survey link at the bottom of the presentation. We'd love to hear your feedback, so please consider doing it. It'll only take a few minutes. Thanks so much.